Welcome back to Indiana News Desk. Senate Majority Leader Mitch McConnell says Congress will act early next year to repeal President Barack Obama's health care law. And on 60 Minutes, Speaker of the House Paul Ryan says repealing the Affordable Care Act will be the #1 priority of Congress. As J.D. Gray reports, the uncertain future of the health care program is making some policyholders apprehensive during open enrollment.
At the Indianapolis Enrollment Assistance Center, people are stopping by to learn about their options for health insurance plans on the open marketplace that was created as a part of the Affordable Care Act.
We're here to help you. We're here to listen, talk through it. We are easing people's feelings and their emotions and to find the best plan that's eligible for you.
Bauer says one man came in and his monthly payments dropped by around $400 a month.
Common question, first question, how much is it? How much is it? So we tell them to sit down with us, bring your income information, and we'll definitely go through that with them about how much it is. We can give them an estimate, but there's nothing like knowing the real numbers for you and your family.
Enrollment opened for 2017 on November 1st. The deadline for coverage beginning January 1st is December 15th, and open enrollment closes on January 31st.
This is year 4 that this year a lot of people have been excited about enrolling. They have a lot more questions, and this has been one of our largest enrollment seasons yet. So we're pretty excited. And the day after the election, there was 100,000 Americans that actually enrolled in a marketplace plan.
But it's the election that is leading to a sense of uncertainty surrounding the marketplace. President-elect Donald Trump promised during his campaign to change the healthcare system.
I think that the reason we have all these questions about when might change happen, if change is going to happen, is that it sounded imminent. It sounded like the first day that President Trump takes office, everything would disappear, according to campaign promises, right?
It's making some ask how a potentially changing healthcare system may affect their coverage.
For the short-term future, the prognosis is simply, there's nothing that will immediately stop the marketplace plans. So the next year, it's unlikely that things are going to change in what's available.
If Trump tries to repeal and replace the law through Congress, Simon says it would take a majority vote in the Senate, requiring a filibuster-proof move to change the ACA law.
The coverage that starts this open enrollment period for 2017 is something that insurance companies have already designed and put into play, well earlier this year. So they cannot just change the prices on you. They cannot, the amount of money that the government has put into providing premiums that are as low as they are, that's there for now. What can change very quickly is whether insurance companies have confidence about whether they're going to take part in the marketplaces in 2018.
According to the Centers for Medicare and Medicaid, Hoosiers make up over 168,000 of the 11 million Americans enrolled in health care programs as of March. As for open enrollment this year, many Hoosiers will be reevaluating their options. Some vendors left the marketplace this year, and they won't be available in 2017. But people who opt to forego insurance will face a penalty. That fee is either 2.5% of your household income or a per-person fee that maxes out at $2,085.
For the coming year, for 2017, we really think that under most possible scenarios, life goes on as normal for the availability of plans, and so this is not something that people should wonder, should I sign up today thinking maybe in January this will all go away immediately and would I have paid for something to gain nothing? We don't. The scenarios that are possible just don't point toward that happening.
For Indiana News Desk, I'm J.D. Gray.